starting in the 70s, we developed these ultra processed foods. And so these are the foods that contain ingredients that you don't have in your kitchen. You can't make Cheetos in your kitchen. I mean, even if you tried, maybe a Cheeto knockoff, but it would probably be way healthier. But these foods are engineered to have a taste profile that never makes your brain feel full. I notice it with my kids all the time. Oh, can I have a snack? They eat the snack, and before it's even finished, they're asking for another snack.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here. Well, hello. Hi, everyone. Welcome to another episode of the Care Room with Dr. Cindy. Today, we have another awesome guest with us. It's Dr. Katrina Coulter. She is joining us all the way from Colorado, where she practices as an infectious medicine physician. She has her own practice there. She's also a coach. And we are just so happy that she's here with us to share her wisdom and give us some tips. It's a very interesting conversation, I promise. So definitely stay tuned. But before we get into things, I'm just going to let her introduce herself and tell us all about what she does.
Thank you for that introduction, Dr. Cindy, and thanks for having me. I'm really excited to be here and hopefully can share
Absolutely.
some wisdom with your listeners. So, I'm Dr. Katrina Coulter. I'm an infectious disease physician. And so what that means is I cure life and limb threatening infections. And so these are pretty serious infections, and to do this, I have a lot of tools available in my arsenal. And some of those tools are pretty heavy-handed. Some of those tools are effective but can be pretty damaging. And so what I've come to learn over my past decade or so of being an infectious disease doctor is that it is really nuanced in how you manage an infection. And sometimes you don't always need the biggest hammer or sledgehammer, that there's lots of options available. And the patient's quality of life after they're treated for the infection is what's really important to me. And so I don't just want to cure an infection and then leave a patient with more problems from the cure itself. I really focus on the whole person and making sure that I'm really leaving them and helping them go back to their good health or in better health than when I met them. So to do that, I focus a lot on the microbiome. And this is something that is not really an organ system we learned about in medical school. This is really something over the past couple decades that we are learning about in medicine as having a big impact on our overall health in multiple organ systems. So it affects your immune system, your metabolic health, your mental health, your endocrine health. And there's a ton of information coming out. And I feel my job is to really sort through that and find out, sort out what's noise and what's actual evidence-based information and how we can utilize that to help prevent infections and to help people heal and live long and well and their best lives.
Yeah, and thank you for doing that. Thanks for taking on that challenge. It's a big thing now. Like a lot of people are really interested, in knowing about their microbiome. I know there are a lot of tests on the market. Can you tell us more about that? I've had some patients ask for those tests.
Yeah, there are several different stool tests where you can send in your poop and get it analyzed, and it will tell you about all these different bacteria and fungi that are present or that are lacking in your microbiome. However, the problem is we really don't have the information yet to know what that means. So
Exactly.
we're starting to see some clues as to, okay, people that tend to be more overweight tend to have different ratios of bacteria than people that are lean, but this is not universal across the board. And what I'm finding with a lot of these stool tests is that then they try to sell you a bunch of supplements. So, oh, you're lacking this and this and this, and you just need to buy this and this and this, and then it will all be better. And that's not actually good evidence-based medicine. That's just marketing, and that's kind of where we are in society is a lot of supplements being marketed without a lot of results being achieved. And so I really caution people when they see all these stool tests. This might be helpful information. And I really am looking forward to a future when I can say, okay, let's maybe get this test and we'll use this as a starting point. And then we're going to make all these lifestyle changes or adjustments. And then we can check again down the road somewhere, but we're not there yet. And so I really want to caution your listeners that they are being targeted with marketing with a lot of these.
Thanks for sharing that, because that is the new trend. We do the testing and then supplements. Okay, something's lacking, you kind of supplement that. So that's good to know, Dr. Coulter. Can you tell us more about what working with you looks like as a coach? Yeah.
Yeah, so working with me as a coach is a 90-day program, and that's because it takes time to shift your microbiome. And
Okay.
so I know we're in this very fast paced society. We're very busy, this hustle culture, and we'd all like there just to be a pill to fix a problem. Trust me, I'm there too. I'm a busy parent. I would love there just to be simple answers sometime. But with the microbiome, it tends to want to shift back to its steady state. So it tends to, you kind of have a default microbiome that you started developing as an infant and was influenced by what your parents fed you and the environment that you were in. And your body kind of wants to shift back to that. And so it takes some time and some significant, in some cases, dietary adjustments and lifestyle adjustments to really start to see those changes. So usually we're not going to see major microbiome changes or shifts for about 8 weeks. That being
Weeks.
said, now you can change your diet, you can change what you're eating today, and within 24 hours, you're going to be growing different bacterial cultures based on what you ate. So there is that effect, but to maintain it takes a little bit of time. And as humans, we also kind of want to go back to our default patterns. And so we might start a new workout program and be really on it for a couple weeks and then, kind of fall off because life starts happening and you get busy. And so I really provide the accountability, the encouragement, the mindset shifts to help people establish a rhythm that works for their lifestyle and that they can maintain in the long term. Because I'm not trying to fix you for 90 days. I'm trying to help you make a shift that's going to last a lifetime. And the really cool thing about these shifts, Dr. Cindy, is that they have ripple effects.
Yeah.
So,
Yeah.
I have someone work with me and then their kids start eating differently, or their circle of friends and start noticing, hey, you're glowing more, you have more energy, you seem happier, what are you doing? And other people start to feel this ripple effect. And that's really what I'm hoping to do with coaching is kind of change as a culture how we approach food, how we're eating, and how we are approaching our health, and not looking so much for the pill to solve the problem or the quick fix, but kind of recognizing how our biology is being affected by our food systems and our hustle culture and busy lifestyle, and how we can make little changes that are going to have big impact in the long.
Absolutely. So is there a target microbiome? What's the ideal? What are we shooting for?
There really is not, but we do know. So I mentioned, there's differences in lean versus obese people, and it has to do. There's like five major phyla, and it has to do with two of these phyla that we seem to see a consistent pattern on. So the Firmicutes versus the Bacteroidetes, and What's interesting about this is that the people that have this lower ratio of Firmicutes to Bacteroidetes, they're actually better at harvesting energy from food. So, evolutionarily, this is a full survival technique that your microbiome developed for a time when there was calorie scarcity. And so, this allowed you to live because you were able to extract more nutrients from food with these certain types of bacteria. But what's really changed is that we are now in a caloric abundant society. So there's no calorie deficit anymore. And our brains haven't upgraded to say, okay, I've had enough. We, we tend to kind of want to, especially if you have that ratio of bacteria, you still want to keep eating because your brain is still in this scarcity of, I need more, I need. And then layered on top of that, starting in the 70s, we developed these ultra processed foods. And so these are the foods that contain ingredients that you don't have in your kitchen. You can't make Cheetos in your kitchen. I mean, even if you tried, maybe be a Cheeto knockoff, but it would probably be way healthier. But these foods are engineered to have a taste profile and that never makes your brain feel full. So they don't trigger your gut bacteria to say, okay, I've had enough, that then sends the signal up your vagus nerve, this gut brain axis that says, hey, that's enough. Instead, it's designed that you eat the whole bag of Cheetos. And then after you've eaten that bag of Cheetos, then you still feel hungry. I notice it with my kids all the time. Oh, can I have a snack? They eat the snack, and before it's even finished, they're asking for another snack. And I feel like it's sawdust. And the really tricky thing, Dr. Cindy, is that some of this stuff is labeled as healthy, and you would believe it is healthy.
Yeah.
Maybe it's a granola bar or a fruit snack, but it doesn't contain any fruit. It doesn't contain any fiber. And fiber is really the key here. So, fiber is what makes us feel full, and fiber is what really feeds those good bacteria that we want. Or the buzzword is probiotic bacteria. And none of these ultra processed foods contain much fiber. They have a lot of sugar, they have a lot of flavorings and shelf stabilizers and emulsifiers, but they don't really contain the actual whole foods that make us feel full, that allow our bacteria to say, hey, okay, that's enough. You don't need to eat anymore. And so then we end up in this kind of over consuming calories. So, long answer to your question, but to get back to it, the ideal gut microbiome is one where you have lots of these probiotic bacteria that live in the large intestine that make what we call short chain fatty acids, and you nourish them with lots of fiber.
Got it. Got it. So, Dr. Coulter, if someone is listening today and they wanted to come see you in your clinic, tell us more about what that process looks like. Do they have to have certain problems, or how can they come see you?
Yeah, so if you're in Colorado and you want to come see me in my clinic, you can get on my website at infinityidclinic.com and book an appointment. So this is a direct specialty care clinic,
Okay.
meaning that you do not have to have a referral from your physician, and I do not contract with any insurance companies. And so you do not have to wait on approval from your insurance company, because I am no longer allowing insurance to dictate how I deliver care to patients. And it is an infectious disease clinic. And so I'm not primary care, but if you have been diagnosed with an infectious disease, or you suspect you have an infectious disease where you're saying something is really feeling off. I get sick all the time. I'm picking up all these colds. I have recurrent UTIs. I just don't feel like my immune system is functioning properly. Then just come on over to my website, book a consultation, and I'm going to spend an hour with you, and we are going to get to the bottom of it and then decide, is there additional testing needed? Is there additional imaging needed? Where do we go from here? And as I mentioned at the beginning, I have a lot of tools in my tool belt. Antibiotics are not my only tool. I'm very well versed in those and good at matching drugs to bugs, but also have a lot of other options if we don't feel like the infection is what's causing the symptom.
Absolutely. Well, thank you for what you do. If they want to see you as a health coach, is that separate from the clinic?
That is. So you can just look up katrinacoultermd.com and I'm there. And I also have a YouTube channel because I really do want to cut through the noise.
Yeah,
I think that there is so much misinformation
absolutely.
out there about what you should be taking or what you need. And I really try to present evidence-based information about what actually helps, what actually doesn't. I'm a frugal person, so I want people to save their money on things that don't work and focus it more, their money and energy on the things that do actually.
Thanks. So now that you've said it, you cut through, you want to cut through all the noise as we close. Can you tell us three myth busting facts that you want us to know as we
Yeah. Oh, I have a bunch, but we'll limit. All right. So number one, probiotic pills.
Okay.
There is a lot of push out there. There's probiotics and everything now. I mean, I see probiotic face cream and probiotic granola and of course lots and lots and lots of supplements. About 50% of people do not absorb probiotics in pill format. So the way that I like to think about it is if your gut is a garden and the probiotics are the seed, you would not plant seeds in your garden every day. You would plant a seed and then you would water it and you would fertilize it and you'd make sure it had plenty of sunlight and you would let it grow into the plant you wanted. So you do not need probiotic pills every day. Most people do not need probiotic pills every day. You can get probiotics from food. That's actually where they come from. It's free. They come in on fruits and vegetables, and fermented foods are amazing. So I really push people to get fermented foods.
Okay.
That's number one. Number two,
Can I
yeah,
ask a question on
of
that too?
course.
Because I think at one point, there were some ladies with yeast infections who were actually doing vaginal probiotics to kind of replace the flora down there. Any thoughts on that?
There is some interesting information coming out and definitely some studies suggesting that that may be helpful. And what is also very helpful in for a lot of perimenopausal, postmenopausal women is vaginal estrogen. And that's related to the bacteria because that helps change the environment back to one that favors lactobacillus, which is what you want. And that helps prevent those yeast infections, those urinary tract infections. So there are some local applications, and I've talked to our dermatologist colleagues about do these probiotic skincare things, do these work? And the consensus I've gotten is it's promising. The data isn't there yet.
Okay.
So we're not quite ready for prime time, but this may be a potential avenue that could really help and prevent somebody from needing to take a systemic antifungal like a diflucan, right? If you can target it locally. So
Messy, but okay. Yeah. Sorry to interrupt you. But yeah, continue. I'm sorry. That was
all right,
number one. Yeah.
number one. So number two is prebiotics. So
Okay.
again, there's a big marketing push. You need this prebiotic pill. Prebiotics are fiber. Fiber is food, fruits, vegetables, nuts, whole grains, legumes, beans. And so we as Americans do not get enough fiber. The goal is 25 to 35 grams a day, and most of us are getting about 5 to 10. And so only 3% of Americans are meeting their fiber requirements. And fiber is prebiotic. This is essential. So this is that soil in the garden. You are not growing good soil if you're not eating fiber. Your probiotics are never going to live. You can take pills all day long. You're going to poop them right back out because it's not going to want to stay if you're not feeding it. It's like you'd be planting in like desert sand. So you must eat your fiber, and I just recommend people start paying attention to breakfast, lunch, and dinner. Does it contain any fiber? what in there contains fiber. An apple is about 5 grams if you eat the whole apple with the peel. And so, you would need to eat, 5 or 6 apples a day to really, and that's kind of the bare minimum requirement you need. And so, really, don't spend your money on prebiotics and probiotics. Spend your money on your veggies and your fruits, and you get all these great antioxidants from it. And then the third, I don't know if this is a myth or maybe just not a known, but our lifestyle actually affects our microbiome.
Wow.
So movement increases the diversity and shifts you towards that lean profile of
Okay.
microbiome. So
You had
even
mentioned exercise, right?
yeah, yeah. And it doesn't have to be, you don't have to go do like a hard workout in the gym. You can go for a 10-minute walk after you eat, which really helps digest your food. It tells your microbiome, hey, we're in harvest energy mode, not store energy mode, and it shifts you towards that leaner profile. And so just kind of that little subtle shift every day, adding in a 10-minute walk at maybe at lunchtime. Again, I know we're all busy. It's hard to find that time to work out. I have a hard time finding it, but adding little movement snacks into your day can really help put you in a healthier microbiome space, which is going to affect your immune system. It's going to affect your mental health. It's going to affect your metabolic health. It's going to pay dividends.
Absolutely. Absolutely. Wow. Thank you for that. Guys, you heard it. You heard it. Probiotics, prebiotics, those are not as, I guess, up there as we would like them to be, or they're
Well,
promoted.
they're widely available to you, and you don't have to go to the vitamin store to get them. You can
Okay.
find them
You can get them
in
at any
Yep.
regular store, grocery store, and the
You
ones there. And then if someone is having, like they're dealing with diseases like Crohn's or IBS, any thoughts there? Do the rules still apply, or of course should they follow the recommendation of their doctor? Any GI?
Yeah, you definitely wanna follow the recommendation of your doctor, but these are conditions, these gastrointestinal conditions are especially where you need to really be dialing in that fiber intake, because that is going to help with your inflammation, and these are inflammatory conditions. And so I do have patients that needed initially to be on these biologic medications to cool down the fire. Essentially, they had the acute flare of the diagnosis, but then have been able to make lifestyle adjustments and eventually come off of some of these biologic medications and maintain these syndromes with diet alone.
Okay.
And there, I mentioned most people don't need a regular probiotic. Some people will. And also, patients that are going to get a lot of antibiotic exposure may need probiotics for a short time. So it's very nuanced, and that's what I do. It's not a one size fits all. This is your unique situation. What can we do to fortify your microbiome and manage this specific condition in the context of these medications that maybe impair your immune system, or if you're on a chronic steroid or something like that. So it is really important. Diet is still very important in these situations, more so, I would say.
Thanks for that. I just wanted to cater to those patients or those people listening, and dealing with that. Dr. Coulter, it was so nice having you on. Thank you for your wisdom. Thank you for your expertise. Guys, she said where she can be found. She works as a health coach. She's an ID doctor in Colorado. If you wish to speak with her, we'll have her Instagram and all her contact info in the show notes as well. But I will be having another fabulous doctor on next week. But until then, take care. Bye.
Thank you, Dr. Cindy.
Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always, always consult your personalized healthcare provider for medical guidance.